Iran needs to spend $1 billion every year on healthcare in order to meet the needs of its people. According to a top doctor in the Middle Eastern country, its 70 million population is set to grow sharply in the next couple of years, and its medical tourists are pouring in. The country's healthcare system is heavily funded by the government, but things need to change as the country's top medical experts call for the strengthening of public-private partnerships.
We need more healthcare service in Iran. Now we have more than 800 hospitals, more than 200,000 physicians. We have renewed the healthcare service in Iran. We need the investment. I am a CEO of the Imam Khomeini Hospital. This is the biggest hospital. We have more than 1,000 beds and 4,000 people working in the healthcare service in Imam Khomeini Hospital. From 10 years ago until now, we started the 3 new projects under the PPP model in Iran.
Currently, Iran's healthcare system is 80% government funded and 20% privately funded. Doctors say the numbers must be reversed in the future. In the GCC, governments are investing billions in healthcare and bringing in the latest technology into the region's hospitals to provide for the medical needs of citizens and residents. In the West, particularly in Europe, the case is not the same. Experts believe far too much is being spent on healthcare across the EU, about $1 in every $5. Governments have reduced spending on healthcare by 10% and will eventually have to raise taxes for additional funding. A short-term solution would be to review workforce expenditures.
In the short term, the best thing to do is to look at things like salaries and actually reduce wages, which is very hard for the people involved, but probably is the most sensible thing to do. We need to also maybe not build any new hospitals, and countries have been cutting all their capital spending has been cut to the bone. And there's things that can be done on pharmaceutical prices to spend less for drugs. All those things, though, are very short term. I think in the long term, we have a much more difficult problem, and we have to start looking at how we pay for health so that we can actually reward people who reduce costs.
Experts add that in general, building up primary healthcare and allotting part of the budget for prevention are the best ways to avoid overspending on this sector. When it comes to new investments, governments must encourage the private sector to get involved. Zeena, Zalamea, Arroya.com, Dubai.